Warmest greetings and good afternoon to one and all. I, Dr. Asavri Sawant, on behalf of Voice of Healthcare, welcome you all to this live panel discussion on colorectal cancer, preventable, treatable, beatable, powered by Viatris. So, to mark March as Colorectal Cancer Awareness Month, we have some very esteemed panelists here with us for the panel discussion. Please allow me to welcome Dr. Satish Kamat, who works at Oncosurgeon Hospital, Aasha Cancer Hospital, Thane. Welcome, sir. I also welcome Dr. VINU Sarthi, who is the consultant medical oncologist at Bangalore Baptist Hospital. Welcome, sir.
Thank you.
I also welcome Dr. Vikas Talreja, who is the consultant specialist at Department of Medical Oncology and Hematology at Regency Hospital, Kanpur. Welcome, sir. I also welcome Dr. VIJAI SIMHA, who is the consultant medical oncologist at Sri Shankara Cancer Hospital and Research Center in Bangalore. He would be joining us shortly. So this session would be led by Dr. Vikas Talreja. So over to you, sir. Now,
Uh, Thank you, Dr. Asawari, and welcome everybody. It is my honor and pleasure to welcome such an esteemed list of panelists right now for such a important discussion for today. That's the colorectal cancer. Colorectal cancer is something which is preventable, treatable, and beatable. A very nice topic, I must say, and a message conveyed to all the listeners across the globe. And I thank Viatris for providing us the platform for the same. Colorectal cancer, why we are discussing it is very important because it is one of the most common, to put into figures, is the third most common cancer worldwide. In 2020, almost 2 million patients were diagnosed with it, and it is second most common cause of death, leading to almost 1 million deaths per year. And this is despite the fact that there are screening techniques that can exist that could reduce the number of the deaths from this disease. And why the month of the March? Because it's the colorectal cancer awareness month that is observed in the March to highlight the importance of the screening for the colorectal cancer habits that decrease a person's risk of developing a cancer of colon, rectum, or anus, the three distinct cancer types that are collectively referred as a colorectal cancer. And particularly in Asia, the incidence of this burden is very high, where more than half of all the cases and the deaths are recorded. India has almost 500,000 new cases and 3 lakh deaths per year. The second is the China, and third is the Japan. So we have the global burden, an increment of let's say 56% as we go to the next decade, with more than estimated 3 million cases. And that's why it is very important that we discuss, because it is one of a disease that has a tendency where we can prevent it, screen it, treat it, and also cure it. And various risk factors are known for it, which we'll be discussing with our esteemed list of the panelists. And I welcome all my panelists. So the first question I would like to ask Dr. Satish Kamat sir is, how high is the risk of the uh, especially based on your experience in the tertiary care center where you work? I believe you see a lot of cases for the same, sir.
Okay. Welcome everybody. Good afternoon. Thank you very much for inviting me for the esteemed panel discussion. And like you said, preventable, treatable, beatable. That's a fantastic topic for the same. Luckily, in India, colorectal cancer burden was low initially, but now I think because of diet changes and everything, it is slowly increasing and becoming more and more important. Initially, it was all breast and all that was taking the headlines, but now slowly colon and rectum, especially rectum. is increasing a lot, especially in the younger population. So it is an important thing. And like you said, since it is preventable and treatable, it should be discussed and we should bring it out to the world that things are improved by simple diet changes, keeping of weight under watch, or whatever, which will be discussed later on. In my practice, definitely rectal malignancy has increased, more of rectum and rectosigmoid compared to the right-sided malignancy. So later on, I'm going to say this, that piles is the bleeding PR, is the main thing they present with, and patients are ignored, saying that this is piles. A simple, at least a sigmoidoscopy should be performed for all cases of piles, irrespective of the age, before treating the piles. That's the take-home message I would like to give later on when the program ends. Dr. Vikas.
Very well said, sir. And to take this further, I would like to ask my esteemed colleague, Dr. Vijay Simha. We know that colonoscopy is the gold standard. So, what do you feel are the screening guidelines for the colorectal cancers in India? And what different screening methods are available in our country in your tertiary care center where you practice?
Thank you, Dr. Vikas. I thank the Voice of Healthcare and Viatris for giving me this opportunity. Am I audible?
Yes, yes, yes.
Dr. Vikas, as you mentioned the word screening, so first I would like to just expand on the word screening. So, screening refers to an attempt to look for disease in patients who do not have any signs or symptoms, and you do it in essentially a normal individual who is otherwise going around his work, and he's essentially has nothing to do with the healthcare industry. So we are trying to attempting to look for symptoms or signs of cancer in a normal individual. So that is what is screening. Now, when we say about screening for cancer, if I say screening for mouth cancer, it is so simple that you just ask the individual in front of you to open the mouth, and you just look into the mouth, and within the next 5 minutes you are done screening for oral cancers. But in contrast, for rectal cancer, it is not so easy. And in fact, it is very often laughed about that colonoscopy, it is often dreaded amongst the normal public. So definitely, in general, that colonoscopy is often considered as a torture procedure. And it involves insertion of a video camera through a long tube throughout the colon, which is around, say, around 1.5 meters in length, and you have to inspect the whole of the colon. And even before you do that, you will have to prepare the patient. So that will involve giving the patient laxatives. So that is purging. So many patients are very not tolerant to this procedure of receiving laxatives. And even after receiving laxatives, it is possible that the patient may not be adequately prepared for the colonoscopy procedure. So, having taken all this into consideration, colonoscopy is still considered the gold standard tool for screening, because colorectal cancers does not happen in just a few days or a few months. Often, it evolves through a pre-malignant phase where it forms a polyp in the colon. So, polyp refers to a small growth that looks like a mushroom, maybe a button mushroom with a stalk. So that is what we want to look for when we do colonoscopy. And when we see the polyp, it is direct visualization, and we can also do a treatment directly when we see the polyp. So it is not only a screening procedure, but also at the same time you can even intervene when you do the colonoscopy. So that's why it is considered the gold standard. So that is the best procedure against which all other procedures are compared. So as I told you, many people are not very comfortable getting a colonoscopy done. So other tools have been tried, other methods have been tried, such as detecting occult blood in the stools. Usually, blood is readily visible in the stools whenever if there is frank bleeding. But more often, from a colon cancer, often there may be bleeding for a long time, but the blood may not be visible to the individual. So we look for occult blood in the stools. That can be done through several. That blood can be detected through several assays. and that may be a warning sign that there is something going on in the bowel. So it is recommended that fecal occult blood test, that is what it is called as, be done annually. And there are also other methods like detecting the cancer DNA in the stool. So you just take a sample of the individual stool and you try to detect if that contains DNA signatures which are there in usually found in cancers. The other things that can be done to look for pre-malignant disease in the colon are to do a CT virtual CT colonoscopy. So you take a CT scan of the patient and through advanced imaging and reconstruction, try to reconstruct the whole colon using the CT images. So that is called as CT virtual colonoscopy. So these are the main methods through which we can screen for colon cancer. But still, as you said, the gold standard, the best method against which all others can be compared is colonoscopy, which again I would say is very uncomfortable for the patients. Dr. Vikas?
Very well said, I must say. And we all know that the incidence of the colon cancer is rising dramatically, and across the globe also, if we see the incidence since uh, a decade earlier, the rate of colorectal cancers has more than doubled in across the universe. But very important, as Dr. Vijay has said, that an early detection and screening does help to it. And we find this as a challenging task, especially in a country like India, where the reporting is very less, as well as the detection and early detection and screening guidelines are not much there. And that's why we are catching a lot of these patients in a later stages, and also very young adults, because many patients less than 18 with an advanced disease. So homing in on the causes and risk factors will help us determining and why there is an early age onset of colorectal cancer, and also why it is affecting so young population. But the first and the foremost thing is the awareness, which we are discussing on this platform for the colorectal cancer, and especially the corona virus pandemic which we had over the last 2 years has forced this long planned discussion for a very long time, and we need to collaborate and do a much more efforts to increase the screening for it. So my next question therefore goes to Dr. Vinu Sathi. As what challenges do you usually observe to the walk-in patients in your OPDs, or to the patients which you go into your draining areas, as why there is a difficulty in early detection and screening of colorectal cancer in Indian population specifically?
Good afternoon to the esteemed panelists. Good afternoon to the esteemed panelists. Hope I'm audible, and thank you to Voice of Healthcare and Viatris for this opportunity. Like Sir has stressed upon, it is indeed very difficult to convince our patients to go for a annual or 10 or once in a decade colonoscopy post the age of 45 or 50 years, what is recommended. The main issues we do face is, unlike breast cancer or cervical cancer where there's a early detectable lump, or in cervical cancer where the bleeding is early, people with colon cancer usually present late because the symptoms onset starts off usually when the tumor is already progressed to at least stage 3 or beyond, and at these cases the chances of cure becomes much lesser. So the main thing is we do not have an established screening program as of yet, and the awareness is much more lower in our population. In fact, the breast cancer screening itself is so low, so hence colon cancer becomes even more difficult for them to be convinced. And only when the awareness spreads, I think the more patients will be detected in earlier stages, and the cure rates will definitely go up. And as far the risk factor goes on, I think the West, like Dr. Satish sir said, we are indeed seeing a rise in young rectal cancers, which may be attributable to the current Western lifestyle, the Western diet, lack of exercise, excessive alcohol intake, and which is a multitude of factors which play together in increasing the rectal and colon cancer incidence. So the main challenge I would find is first the awareness, and second, patients have to be educated that post age of 45 to commence techniques, also like CT colonoscopy or fecal occult blood tests, and so that more patients gain access to such methods and we can detect colonoscopy earlier. Thank you.
Very well said, I must say. And over the last many years, if we look at the lifetime risk of a patient developing a colorectal cancer, it's approximately 4% across the globe. But there has been a gradual shift towards the right side or the proximal colon cancers internationally and nationally also. There has been age also, because age for cancer is a very particularly major risk factors um, for it. But over and above, we are seeing a lot of young individuals getting diagnosed with colorectal cancers and with a symptomatic disease. The reason may be multifactorial, and there are a lot of genetic influences, environmental influences, and lifetime exposure. And that's why we would like to ask from our esteemed panelist, Dr. Satish, sir, as have you seen that the colorectal cancer occurrence has changed over the time, and are you seeing any age specific trends of incidents that we are observing, especially in the young population over the time for the colorectal cancer?
Uh, Definitely, I think this has already been answered. With the more and more younger patients, especially in India, are coming positive. That is the sad part. And not only they are coming positive, they are advanced or metastatic. That is the sad part. As far as I just wanted to touch on the screening part, which Dr. Vijay said, colonoscopy is an invasive procedure. It is like this: someone asked me to do it, I would think 10 times before doing it. So in India, that is not yet, and it is again a costly procedure. So people have to shell out money. So if anything is free, people, even for pap smear, ladies are not ready. So colonoscopy is way ahead. Second, occult blood. Unfortunately, in India, maybe colitis, other colitis, COX is still so common. So COX, again, occult blood is going to be a negative sign. So what normally I suggest is have a healthy diet, reduce your obesity. If symptomatic, show doctor, and if not treated, recovered, then suspect and then do the colonoscopy, ultrasound, CT, whatever required, because that is the way we could detect it earlier. It is especially 5% are only genetic, that is 95% are sporadic. So patients, relatives, especially if they have polyps, those are the one I advise a check colonoscopy and screening if required. The others have to have a big, even the doctors have to be taught to have what we call it as a high index of suspicion. One should not think that he is just 20-year-old, so he will not have malignancy. He is 40-year-old, he will not have malignancy. So like I said, if a patient with bleeding PR, piles, fissure, definitely treat for that, but then just at least do a sigmoidoscopy to rule out a rectosigmoid malignancy. That is what I would suggest. Please, Dr. Vikas.
Thank you for those enlightening pearls of wisdom, I must say. Colonoscopy, colon cancer per se, if we see, it is a accumulation of multiple risk factors, as we were discussing, apart from the hyperlipidemia, the obesity, the alcohol consumption, the increasing metabolic syndrome, hypertension, chronic kidney disease, unhealthy dietary patterns, low vitamin D intake, and sedentary lifestyle which we are following right now, the occupational exposures, and a lot of environmental and lifestyle changes. And with more and more uh, screening available right now, more and more options of treatment that are available right now, even though we are catching them early, we are treating them and we are preventing them. And that's why we are seeing that the mortality over the past few years, especially over the last 7 8 years, have drastically improved from what the survival has drastically improved, with nearly 65% of all those patients who were treated for colorectal cancers are surviving more than 5 years, which gives us a very encouraging figure. As to take to the next question to Dr. Vijay Simha, that do you think that there are a lot of treatment options available for the colorectal cancer in India, and do they vary across the globe as we compare with the American and the Indian standards? And also your expert opinion as what are the new targeted therapies in your platter right now when you discuss a patient who has an advanced colorectal cancer in front of you.
Okay, thank you. So coming to the part where we speak about the treatment, so if the colon cancer or even the rectal cancer presents with a limited early stage disease where it is quite operable, I think the most best treatment would be actually to do the surgery, especially for colon cancer. And that is the treatment that gives the hope for best chance of cure for the patient. And even there is an entity called oligometastatic disease, where the disease is intermediate between early stage disease versus an advanced stage disease. And even the entity called oligometastatic disease also is to a certain extent quite curable. But however, if it is an advanced stage disease, then the intent of the treatment will be only to control the symptoms and control the disease and to prolong the life to the extent possible. So in colon cancer, especially in the non-rectal colon cancer, the main treatment will be surgery. And if it is at stage 3 after surgery, and some of the stage 2 cancers will require adjuvant chemotherapy. And if it is a rectal cancer, it will usually require neoadjuvant chemoradiation that will be followed by surgery and adjuvant chemotherapy. As far as advanced colorectal cancers are concerned, they're usually the advanced ones are when the cancer has spread beyond the intestines, that is beyond the colon and rectum, and the most common site where they are going to spread is to the liver. And apart from the liver, further they can also spread to the intestine mesentery, which is the other lining of the abdomen, inside the abdomen. And once it is spread to these regions, it is essentially considered as not curable. So at this point of time, when the cancer has spread beyond the bounds of surgery, so the treatment will be with systemic chemotherapy. And the intent of the treatment will be only for control of the disease and to the extent to palliate the symptoms. However, the treatment of colon cancer, even in advanced, even when it is at an advanced stage, is actually quite well evolved with new treatment options that have come up since the last 2 decades, especially with the advent of targeted agents. And the most important targeted agents is the development of EGFR monoclonal antibodies, which are called as cetuximab and panitumumab, and also antibodies which can be given to decrease the vascular blood supply to the colon cancer. That is to the use of bevacizumab. And also there are some newer agents that have come up just in the past few years, like immunotherapy, and sometimes based on personalized medicine, when the cancer can show certain targetable mutations, like if there are certain NTRK mutations that can be specifically targeted by newer drugs called larotrectinib. And with the advent of all these newer therapies, it has been seen that the colon, even in advanced stages, the average survival of colon cancer can reach almost up to 25 to 30 months from the point of diagnosis of advanced disease. And this is mainly with the help of cetuximab and bevacizumab and conventional chemotherapy, which is added to these treatments. And before selecting a patient for this targeted therapy, it is recommended that some mutational analysis be done on the colon tumor tissue. Especially these mutation analyses are called RAS, all RAS and BRAF mutations, which are common in colon cancers. They must be done in preferably all the patients with colon cancer. And the patient should be given an option to choose from whenever feasible, the targeted agent should be added, especially bevacizumab, which can be used in almost all the sites of colorectal cancer. And it has particularly a disease stabilizing action because of its anti angiogenesis effect. That is, bevacizumab helps prevents the cancer from forming new blood vessels, and the new blood vessels that the cancer form is the main reason why it can further grow and further spread. So bevacizumab is an injection which can prevent these new blood vessels forming, and hence it will prevent further growth of the tumor and also further spread of the tumor. And as far as the availability of these agents is concerned, these agents for most of these periods, bevacizumab was not available as generic drug. But nowadays, since the last 2-3 years, we have generic versions of bevacizumab. Since the last, I think, since 2021. So it is accessible to many more people, and many more people can be benefited in the advanced stages. However, I think cetuximab and panitumumab are still under patent, and hopefully in the next 2-3 years we'll get the generic versions of these drugs. But it is very important that the patient be counseled regarding the availability of these agents. Especially in India, we have access to this freely, so the patient must be given an option, because they truly play a meaningful role in prolonging the progression of advanced stage cancer to a large extent, that is to several months. Dr. Vikas?
Very well said, and this message should be clear out and loud that the diagnosis doesn't mean the end of the disease, end of the life. It just means it's a starting of a new life, and we should be fighting the way we have been fighting over the last many years with various pandemics, with various other diseases. It's just a stepping stone for a better life ahead. I believe there are a lot of latitude of options right now, which was discussed by Dr. VIJAI in a very enlightening manner as what stage by stage treatment options do we have. And it's even it's a stage 4 disease, it doesn't mean it's the end of the treatment. It's just the beginning of a better treatment, I would say. And we should not be losing our hope. We should be keep on doing more and more efforts to fight it more effectively. Uh, every day, most of the times, especially we get a lot of questions across uh, when we deal with cancers, as diet has been a very important factor when we see cancer in its origin, or it's in its treatment, or it's in its remission. And colorectal cancer itself has a very important link between the consumption of various products. If we Google out, there would be hundreds of questions across what fiber diet to take, what starch diet to take, what uh, vitamins to take, what garlic, what fish to consume, how coffee influences the colorectal cancer. And especially we have a discordance between the non-vegetarians, vegetarians, and those who are vegetarians with a sea water fish consumption, also known as the pesco vegetarians. So I would like to pass on this question to Dr. Vinu Sarathi as can you please touch upon and tell us what specific dietary recommendations you look for in those patients with colorectal cancer who are suffering from it, and which has a role in prevention and treatment for the same? Dr. Vinu.
Yes, sir. Definitely. the diet plays a major role. Like screening would pick up tumors either in the precancerous polyp stage or in an early stage. But like Dr. Satish sir had said, the best form is prevention. Prevention is always better than detecting the cancer. So as we have moved away from our traditional diet into Western diet, which constitutes more of refined sugar, high saturated fat, and lesser intake of fiber, we are seeing a recent trend of increase in colorectal cancers. The ideal diet would be definitely a diet rich in vegetables, fruits, green leafy vegetables, high on fiber such as wheat bran, oats. A lot of research has been going into millets, especially in India. The role of millets, which has an antioxidant role, anti-inflammatory role, and definitely these help as a way of to whatever inflammatory products are being consumed in terms of meat, they may to a partial extent even annul these effects by increasing the by decreasing the colon transit time, decreasing the absorption of inflammatory products, and fruits, vegetables having vitamin A, E, and all magnesium, all trace elements having an antioxidant role in itself. So definitely diet change is switching over to a wholesome diet. What we say is plenty of fresh fruits, vegetables. Fiber should constitute at least 15 grams per day, which a study has shown to decrease the incidence of colorectal cancer by as much as 30%. Definitely plays a major role. As far as meat is concerned, red meat has shown to have a significant level in increasing the incidence of colorectal cancer. Red meat consumption, I would not recommend it to completely avoid, but definitely the lesser taken, the better. So probably once in a while, red meat may is would definitely be recommended. White meat like fish and chicken don't add to the risk of colorectal cancer. Avoiding red meat, especially in its processed form, like ham and bacon, and especially in the salted form or smoked form, should definitely be avoided or limited. And not avoid excessive alcohol consumption. Keep it to the limit, or preferably abstain. All these would definitely go help in a major way. Adequate exercise, 150 minutes of aerobic exercise a week, maintain ideal body mass index. All this will definitely play a major role in preventing colorectal cancer. Thank you.
A very important point said by Dr. Vinu, as colon cancer does have a very important underlying cause for the diet, and therefore, compared with non-vegetarians, vegetarian dietary patterns have shown a significant reduced risk of colorectal cancers, and among the vegetarians also the most pronounced being among the pesco vegetarians, and therefore we need more of a high fiber diet and vitamin D and a good folate levels and calcium levels as a protection factor for for this uh, disease to prevent and to further spread. And that probably we are exceeding the time limits. I know it has been a very enlightening session. We have dealt across a lot of topics as why, ranging from the incidence, screening, treatment, and also the prevention and what to eat, what not to eat while discussing this. And even though we know that the screening utilization for the colorectal cancer remains low than that of the breast and the cervical cancers, despite large evidence for the latter, and that's why we see a lower catching and catching of more advanced disease when they become symptomatic. So, if they have to give a message to everybody, each and every panelist right now, as when the audience is keenly listening to you, what would be your message for all the people across India who are right now online? So, we'll start with Dr. Satish KAMAT, sir, as the ending note for this enlightening session, sir.
Okay. I think it was a good session where all the points were highlighted very well. There is a new concept which is coming now, that the death begins in the colon. This is a new concept which is coming up. The whole body starts decaying if the colon is not maintained properly. And for that, the role of probiotics and prebiotics is considered to be very useful, and a proper intake of that can improve longevity and reduce the other diseases in the human body. So this is the big thing which in the long term I think is going to come out with big results. Having good quantity of pre and probiotics in the diet will definitely reduce the incidence of colonic malignancy and in general improve the health of the person. Other thing is micronutrients are also important, and we should stick to our Indian diet. We are luckily having a complete meal where we eat chapati, dal, rice. We should not remove everything. So whole diet comes into our body, and very important is the dahi or chas which we drink. So that gives us our natural pre and probiotic, which is very protective. So I think we should continue the same. And a small, like again, I come back 30 minutes of walking or a simple exercise, all of us should do to reduce in general all our health problems. Thank you very much for giving me this opportunity.
Very well said, sir. Dr. Vijay Simha, your ending note to every uh, person across India who is listening.
So in my clinic, when I see a patient and so some lady comes with a breast lump, and I said, "How did you know that you need to get screened?" And she said, "I heard in the radio or I read in the paper that I should not neglect it." And then I'm very happy to see that some screening or some awareness program is has been useful. So if this is even helpful for even one individual, I'll be very happy, and I'm sure with the outreach of Voice of Healthcare, I'm sure many individuals will listen to this uh, uh, discussion that we have had, and I think it was quite useful. And I hope many people will be benefited by this. My message would be that um, definitely colorectal cancer, as deadly as it sounds, it is quite preventable. So do prevent it to the maximum extent possible. Do not ignore symptoms, especially bleeding that is occurring in the stools, altered bowel habits. Do not postpone your consult with a doctor. It's the early contact with your doctor that may help you in the long run. And once it is, if ever it is detected, please don't panic. It is definitely treatable. In the early stages, the cure rates are definitely very good. With surgery and adjuvant chemotherapy, many of my patients do come and they live long for 5 years, 10 years, and definitely they do get cured of their cancer. And if it is in advanced stage, still it is not the end of the road. Still, it is possible to contain the disease and control it, and almost it can be brought to the ambit of a chronic disease. It can be made to be treated like any diabetes, hypertension with the availability of these modern drugs. Please do consult with your doctor if you are eligible to receive these medicines, and definitely spread the news around. The whole concept of March being Colorectal Cancer Month is that more and more people are aware of this disease. So if perhaps your friend or your neighbor is complaining of such symptoms, do tell him that this could be colorectal cancer, so you need to get screened. So to have a low threshold, so preventable, treatable, and beatable, that's really perfect. That would be my ending message. Thank you, Dr. Vikas.
Thank you, Dr. Vijay. Dr. Vinu, your ending note to everybody out there.
Like all the seniors have rightly summarized, definitely it's preventable, treatable, beatable. Please, all of them adopt a healthy lifestyle with wholesome food, plenty of fiber, and everybody has to be aware that any nagging symptoms which doesn't go away, like blood and stools or persistent lower abdomen pain or any altered bowel habitus, please go immediately and get it checked so that it's caught at early stage. And unlike breast cancer, where the lump appears early and it's easily palpable, these are all organs which are deep in the abdomen. and we may not pick up the sign symptoms unless it's already spread pretty late. So please be aware that there are screening methods even for colorectal cancer, and these screenings are strictly adopted in Western countries that at the age of 45 they have to get a colonoscopy or they're not covered under insurance if the cancer appears later. So we have to also spread the awareness that there are effective screening tools, and so that it can be caught at the earliest. And like Dr. Vijay sir said, the cure rates are high, as much as 85-90% is caught at stage 1 and 2. So definitely, thank you.
Uh, Thank you, everybody. Colorectal cancer is a common and a lethal disease, and it is preventable, treatable, and beatable, as all of my esteemed panelists has stressed specifically on early screening and, if detected, early treatment, and to treat it more and more effectively. I give this platform to the organizers right now, and I thank wholeheartedly Dr. Vijay, Dr. Satish, and Dr. Vinu for being such a sport and giving us such a invaluable time of yours as for a very important discussion for the colorectal cancers. I hope everybody who listens to this do get their screening done, and do encourage their family members to get their screening done. Over to the organizers, and